Hi, welcome to Dialed In. I'm Don Knabe, Los Angeles County Supervisor for the 4th District. I'm pleased to welcome you back to another episode of Dialed In. For this segment, we'd like to take you inside the Los Angeles County Department of Public Health. This is one of those departments in the county that you might not know too much about, but probably impacts you every day. Public health is responsible for protecting the health of our residents by preventing diseases, promoting the well-being of all 10 million residents of our county. They educate our residents about all kinds of health issues, from heart disease to cancer, diabetes, HIV/AIDS, the list goes on and on and on. Public health also keeps us safe by inspecting our restaurants, our water supply, our apartment buildings. They even have a team that prepares for us in case of natural or man-made disasters and works actively on bio-terrorism and toxic exposure issues. You name it, public health is trying to protect you. I'm pleased to have a few representatives of the department join me today to share with you all that they do to make Los Angeles County a healthier place to live. I hope you will enjoy the show. Welcome back to Dialed In. Our first guest today is our Director of Los Angeles County's Department of Public Health and the county's official health officer, Dr. Johnathan Fielding. He is responsible for all public health functions, including surveillance and control of diseases, health protection, including against bioterrorism for our county's 10 million residents. He directs a staff of over 4,000 with an annual budget exceeding $750 million. Dr. Fielding is a professor in the schools of medicine and public health at UCLA. He received his medical and public health degrees from Harvard University and an MBA in finance from the Wharton School of Business. Thank you for joining me today, Dr. Fielding. Appreciate you taking the time to be with us.
Thank you so much, Supervisor.
You know, I spoke about in your introduction about the Department of Health and what we cover each and every day here, and from drinking water to diabetes to obesity to disasters. Tell us about some of the really main things that you do. I know we'll talk a little bit later about your overall responsibilities, but what are some of them you consider the main functions of the Department of Public Health?
The most important function of the Department of Public Health is to protect the health of every resident of LA County. So I wake up in the morning saying, what do we need to do to make sure that people's health is protected, that they're not getting sick for things that are entirely preventable? And everybody in our department is a public health first responder. So like when we had the H1N1, and it was very serious, we mobilized everybody. We gave out 200,000 immunizations and points of dispensing around the county. So emergency preparedness is really job number one. Now, of course, other forms of protection are things like restaurant inspection, inspection of the mobile food trucks, inspection of swimming pools, inspection of multiple unit housing to make sure they don't have health violations, all in emergency preparedness mode. But we do a lot of other things. For example, something most people wouldn't know is we have a veterinary public health group, because a lot of the new infectious diseases that come and affect us come from animal reservoirs. That's just one example.
That's a big unknown fact to the folks out there.
Yeah.
So we're in the middle of summer, hot times, you know, all over the country, and it's starting to get warm here in Southern California. Beaches, cooling centers.
Yes.
How do you, if you were to decide every once in a while we have to close down beaches, what makes up that situation to close a beach?
Well, we monitor the beaches very, very carefully. And if there's an increase in evidence of bacterial or viral contamination, we will then post it. We'll close the beaches until we have testing that says they're safe for people to swim in. Now, that occurs more during the winter when we have storms and then you have runoff, but it also can occur, you can have spillage and other problems during the summer as well. And the heat alerts, we monitor the heat, and we put out heat alerts, and we recently put out a heat emergency for some parts of LA County. Cooling centers were open. We recommend to people to not do much physical exertion except, you know, early in the morning hours. We talk to schools about not having practices as they would normally in the hot part of the day, and camps as well. So we're very concerned about heat, and in fact, with global warming, that's becoming an increasing problem.
So the cooling centers, does that require an inspection by your department before you can say that you're an official cooling center, or before you can turn on the water or the mist or whatever you do?
No, no. The cooling centers are basically places that are already functional, but when we declare a heat emergency, they are going to extend their hours. They are going to make sure people are there. So it could be a senior center. Some libraries could open, as well as places that are operated by different municipalities.
So you know where they are, though? Do you,
oh, yes.
I mean, so the public, how do they find out where a cooling center is?
Well, it depends on where the heat is most, but we will then put a list on our website. They can also call 211, and we also tell people, in addition to cooling centers, go to the mall, go to some other place that's cool. Doesn't have to be
I saw something on the news this morning that the movie business is doing 2 or 3 times better than they ever expected this summer because people are so hot all over the country, they're going to movies. And probably the same thing here then.
I think that's probably true.
So in a situation like North County, so the folks up there, when they, you put out the heat alerts, up there they could go to the website and find out, well, there's a cooling center here and there's a cooling center here.
And the hours.
And the hours that they're available.
Yeah, exactly.
What are some of the major campaigns that your department's working on right now?
Well, of course, I talked about emergency preparedness being the most important, but the other aspect of our work that kind of coalesces a number of functions is health promotion, is making sure that people have the opportunity to be as healthy as they want to be, which means improving our health. 24% of adults in Los Angeles County are obese, another 27% are overweight. So it's a very serious problem.
Well, this is starting to get personal now.
We all can pay attention to that. But one of the things we've done is we've had a campaign called Choose Less, Weigh Less, which means, you don't have to change the food you're eating, but change the portion size. We talked about fast food, and if you didn't order a double mac with cheese and instead ordered a single one, and you had a medium fries instead of a large fries and a small beverage instead of a large one, you could save 500 or 600 calories in that meal alone. We've had a major campaign on sugar-sweetened beverages, and it shows a sugar-sweetened beverage being poured into a glass, and all of a sudden that liquid becomes packets of sugar, and it says, you wouldn't eat 22 packets of sugar, why are you drinking them?
Yeah.
We've had major campaigns and continue them on nicotine replacement, tobacco cessation. So we work with California Hotline, Smokers Hotline 1-800-NO-BUTTS, advertising that. To make sure that people who want to quit know that they can get
pretty
free.
effective advertising too, am I
Yeah,
right?
they can get free nicotine patches.
Well, they can get them free.
They can get them free.
So how, here we have a county, the largest county in America, a very diverse population. As we know, probably maybe 140 different languages spoken. How does something as important as your department get the word out?
We try and get the word out by having partners in the media, and we put out a lot of press releases. We make ourselves available for discussions on the media.
How do you deal with all the different languages?
Well, everything we put out in English and Spanish. Now, when we have the opportunity to, in terms of resources, and there's a clear need, we put it out in another language.
And you work with some, there's a lot of health organizations within, say, the Korean community, the Chinese community, Filipino community. Do you work with those organizations to make sure that they can get a press release quickly so they can get it out to their community in the language that they speak? Is that how you do it?
Absolutely. And with emergency preparedness, when we've talked about what you need to do to be prepared, we put that out in 9 different languages. So, but it's really important that we have deep roots within communities working with people, because it's not only a question of the language, it's a question of the people that they come to trust. And the trusted people in their communities we want as full partners in letting them know what's important.
Well, it's big, and I mean, 211 is probably as important to your department as any department that we have. I mean, because when you get to the public safety side, it's 911, but 211, they can get directed to the right information. A few years ago, I just finished a couple of terms on the Homeland Security Commission appointed by the President. Obviously, an important part of that was the bioterrorism, the disaster kinds of planning. How are you involved in that? One of the things, let me just, before you answer the question, just remember, when 9/11 hit, I'll never forget, we had a bioterrorism, your department had a bioterrorism drill scheduled for the February following.
That's
Everybody
exactly
thought
right.
that was in response to 911, when in fact, you had scheduled that a year before.
That's exactly right.
So maybe you can sort of give us some of your disaster planning, bioterrorism, what we do to get prepared here in Los Angeles County.
Yeah, thank you. We're on the front lines. We've been working on this since 1999. And we've been focused on early warning systems. So we work closely with the FBI and with other organizations, with the sheriff, with the police departments, to make sure we're looking at what could in fact be a particular problem in biological terrorism, chemical terrorism, dirty bombs, even nuclear terrorism, the unthinkable. But of course, we also have to be concerned about natural disasters. So we have monitoring systems. We're getting information on a real-time basis from hospitals. What are they seeing in the emergency rooms? We also have information on outpatient medication. So we're looking to see all of a sudden in one part of the county are people all of a sudden buying anti-diarrheal medicines or cough medicines or whatever. So we have a lot of early warning system surveillance that is important. And then we have expertise. We have people who have expertise in all of these areas, and we have advisory councils and groups that can get together in a moment's notice to try and help make sure that we're controlling a problem. So as you said, for the anthrax example, I mean, it's critical that we know that as soon as possible, because anthrax is a treatable problem if we get it real early, and if we don't get it early, it's not a good situation.
So how does this information get to you that quickly in a particular area? 4,000 square miles that we've got here in Los Angeles County. So I mean, one particular area with the diarrhea medicine or the cough medicine, or how does that feed into you? Who is watching? Your public health officers in that area?
We know. We have a central surveillance unit that collects all that information and analyzes it. We have something called Syndromic Surveillance that looks at what is showing up at hospitals, for example. Are they seeing something different than they expected to see? Are they finding some illnesses that they don't know what it is, but it has a consistent pattern? So yes, we have experts in infectious disease and emergency preparedness, chemical terrorism, toxics, epidemiology. It's really important that get the kind of attention that people, this is working in the background, so people don't see this.
People don't have any idea what we do each and every day.
Public health is invisible.
Purpose of this show,
Thank you so much.
And it is public health, and it's an incredible responsibility. For people watching, if there's one thing you could tell everyone, hey, how do you maintain better health? What you should do? Is there one thing? I know you talk a lot about obesity and all the other issues, or is it something else that you think would be a high priority for people to just live better?
Well, let me say two things. One, something people know, but it's really important that we look at this issue of overweight and obesity, and there are two pieces of that. Now, for most of us, you can't exercise enough, so you have to also focus, unfortunately, on how much you eat and what you eat, more fruits and vegetables, portion size, not so much sugar-sweetened beverages. That's really important. And physical activity has to be a part of what we do every single day. Build it into what you do. You've approved, the Board of Supervisors approved all these extra bike paths, for example, areas where people
We're trying
can
to build
walk.
in part of the whole regional planning process, exercise areas for the community. So it's really important, but I really appreciate it.
There's one other area that I would just to point out very quickly, and that is prescription medication. There's an epidemic of really serious problems with prescription drugs that get left in it. And unless we, and particularly those that are used for painkillers that are opiates, we have to focus on that as well. That's something most people don't think about. Don't leave these things in your closet when you've gotten an operation or something. Make sure you dispose of them carefully and safely.
Dr. Fielding, I really appreciate you taking the time to join us today. Your department is extremely important to the lives of the 10 million residents of this great county. And what we do here also sends a message not only through California, but nationally as well, too. So I want to thank you for what your staff does each and every day on behalf of the citizens. And again, thank you for taking the time to join us today. Appreciate it.
Thank you, and thanks so much for your support.
Welcome back to Dialed In. The Department of Public Health is responsible for protecting the health of all Los Angeles County residents. But what happens when the health and safety of our public is jeopardized by the outbreak of a dangerous disease? The Community Health Services Division is responsible for investigating those diseases and protecting the health of all of our residents. Here today to discuss how the department can protect our 10 million residents is Dr. Maxine Liggins. Dr. Liggins has served as the Area Medical Director for the Department of Public Health since 2001. She is a specialist in infectious diseases and public health medicine. Thank you for joining me today, Dr. Liggins. People wake up in the morning, they're watching the national news. It could be ABC, NBC, CBS, and there's a public disease issue out there or some kind of a disease situation. How does our Department of Public Health begin their investigation?
The department begins the investigation after we get a report of disease. The laws of the state of California mandate that healthcare providers, hospital infection control providers, pharmacists, coroners, morticians provide reports, and laboratories provide reports to the Department of Public Health. What happens is these providers send in reports to us. We have physicians, nurses, epidemiologists who work on those reports. After receiving a disease report, they start an investigation. The first step in that investigation is to make sure that what's being reported to us is actually happening. Then after it's reported to us, we send reports out to different offices in the Department of Public Health. They then are in charge of conducting an investigation. Their investigation is, first of all, to make sure that any member of the public is safe, that the spread of any disease has been contained, and that the public is adequately treated. And
so how does that relate then? At what point is, like, the Center for Disease Control in Atlanta, are they notified at any point during that investigation?
Yes, they are, especially if it's something of high importance. For example, an outbreak of the flu would be something of high importance. Recently, the TB in the homeless population in LA was reported to the to the Centers for Disease Control. And obviously, as you've heard in the news, outbreaks of any avian flu would be reported to the Centers for Disease Control immediately.
So how do you track it then? Once you've gone through the process, you've identified it as a potential problem, does that initiate the tracking then?
Yes,
as it relates to all the reporting requirements coming into your department?
Yes, it does. And we are constantly tracking different diseases. We're also tracking the occurrence of outbreaks and conditions. And what we do is we look at where the disease first occurred, whether or not it occurred in any of the people that the first individual was in contact with, and whether we received reports from other parts of the county, so that we're doing all of that simultaneously.
What about immunizations and vaccinations? I mean, how does that work into your area of responsibility, whether it be a specific disease or just day-to-day, head colds, flu, you know, viruses?
The department traditionally does provide vaccines for children from ages 0 to 18 automatically. And we do that especially for uninsured children. We are very diligent about the need for vaccines. We also provide vaccines for outbreaks, and you may have recently heard about the hepatitis outbreak, and we provided vaccines for the general public for that. We also provide vaccines for any individuals who've been exposed to an outbreak of any sort.
Are they free?
Yes, they are. They're free. Individuals can come in, get a vaccine without an appointment. They do have to look and make sure that the clinic is open during those times. And we have health centers located in all of LA County.
So they can go to any of our county health clinics, or if they went to an emergency room, which they probably shouldn't, but if they did, they'd be directed to a clinic where that might be available. Is that correct?
Yes, they would be directed to the nearest county public health center.
So the resources available are what, clinics?
We have clinics available. Those clinics provide treatment for communicable diseases, and communicable diseases are diseases that pass between other people. We also provide tuberculosis care. We provide the majority of tuberculosis care in LA County. We also provide sexually transmitted disease clinics, and we also do a lot of surveillance, meaning we're constantly looking for disease outbreaks, and we do those activities in the health centers as well.
We've read recently a number of cases or issues of potential West Nile.
Right.
Do we need to be concerned about that this year?
Yes, we do. We especially need to be concerned about it during the summer months, between June and September. But there are actions that each of us can take. Number one, we need to eliminate sources of standing water. And some of the things you might not consider as standing water would be bird feeders, would be pet dishes, would be abandoned swimming pools and houses, would be old tires full of water. We can avoid West Nile by the use of repellents, by long sleeve clothing, as well as making sure that when we go out for activities in the early morning and the late evening that we're wearing insect repellents as well.
So as it relates to ways people can take care of themselves, I mean, those are some of the issues as well too, but overall, you have a lot of areas of responsibility. Everybody's talking about the Affordable Care Act. Is that going to affect your area of responsibility in the Public Health Department?
Yes, it will. Number one, more people will be insured. And so therefore, some of the people that we're providing vaccines for, we may not have, those people will have insurance in the future. It will also make it more important for us to make sure that people have actually signed up for their coverage under the Affordable Care Act. We are concerned about how it will impact us and how it will impact the county health system in general.
Absolutely. Well, it's been a very brief time. We could go on and on about your particular area of responsibility, but once again, I really appreciate you taking the time not only to be on the show, but what you do each and every day on behalf of the 10 million residents of the largest county in America. And you're a very important part of that, of the public health system, and I just thank you for your time.
Thank you, Supervisor Knabe.
Welcome back to Dial In. Have you ever been out to dinner with your family and noticed a big blue letter in the front window of your favorite restaurant? That letter is a rating from the Los Angeles County Department of Public Health, which is responsible for grading all food facilities, including restaurants, as well as the hot new mobile food trucks here in our county. Here to discuss the process for inspecting restaurants and assigning them a rating, please welcome Brenda Lopez from the Environmental Health Division. Brenda has over 10 years of experience as a food inspector and is now a manager over the department's food programs. First of all, thank you for joining me on the show today, Brenda. Appreciate you taking the time to be with us.
Thank you.
You're an inspector, all right, as I mentioned in your bio and welcoming you. How many restaurants a day do you inspect?
Typically, on average, an inspector can inspect 4 to 5 facilities a day, depending upon the risk that's associated with the restaurant and the size of the facility.
So there's always restaurants, or it could be donut stores, it could be anything.
Liquor stores, prepackaged food stands, vitamin stores.
Supermarkets in the back?
Supermarkets.
So how long does a typical inspection last? Like you said, I mean, it depends on the size, I guess, huh?
It depends on the size, and it also depends upon what we find when we enter the door. If there are critical risk violations, then we're going to take longer to do that inspection. But on average, a prepackaged food stand will take us less time than a moderate or a high-risk restaurant.
So, letters, ABC, right? We're all looking out for those all over the county. What do they mean?
They mean that we have conducted an inspection. And when we conduct an inspection, our inspection report starts with critical risk violations. Those are usually 2 points or 4 points that are deducted if we find that violation.
What does that critical piece mean? Like, is it hands on food, or heating, or hot and cold, or?
Unapproved temperatures. We have found something from an unapproved source. Food that has to be disposed of because it's in the critical zone of food temperatures.
You're not making me very hungry.
I'm sorry, sir.
So, I mean, so A is good, right? I mean, that's what they strive for. B,
yes.
What is B? What happened for them not to get an A?
Well, in B, they have reached either 80 to 89 points.
Okay.
And what happens is you start out with 100 points. When we go through and we start looking at violations, at the end, we subtract, and then that's the score you receive. But it all depends upon what we have found. Those could be a mixture of critical risk violations and good retail practices.
So we've gone from A, B, now we're down to C. So from B to C, I would imagine that's 70 to 80 or something like that?
70 to 79.
70, 79. So some serious things are starting to happen when you start to get a C.
There can be, yes.
Such as?
There can be cockroaches or rodents that we have found in the facility, which require us to close the facility, a sewage backup, or unapproved temperatures. When we see unapproved temperatures, depending upon where we find them, then we're going to deduct points for that.
So a restaurant can be closed with a C rating, is that correct?
Yes.
Okay, so now, I was joking with you earlier about letters, and you don't go below C because what happens then? We
assign a letter, actually a score. So 69 and below, you would actually see the numerical score.
Wow, so
yes.
That's when you start seeing numbers.
Yes, sir.
You start making left turn or right turn and go look for another place to eat. So what about outdoor seating? I mean, we went through a big thing with allowing animals, dogs, to be at outdoor restaurants, outdoor facilities.
Yes, we allow that. Under certain circumstances, we don't want the animal to be brought through the restaurant. We like them to come through a side entrance, you know, an outdoor entrance. There's no food preparation in that area.
Strictly a place to eat, and
yes.
You just don't want the dog sitting on the chairs or paws on the table.
Correct. Correct.
What about the mobile food trucks? That's the big hot thing right now.
We have quite a few out there.
How do you inspect those differently than, say, a restaurant?
We inspect them with the same California Retail Food Code. There are chapters that are exclusively for mobile food facilities, but we have a route that the facilities give us. Then we go where they tell us they're going to be that day during the week. They give us a typical route sheet, we call it. And then we go there to see if they're there. If they're not there, there may be someone else there, and we let them know. We knock on their door, and we tell them we're here to do an inspection.
So do they know you're coming, or are they spot? And I assume the restaurants, places don't know you're coming, right?
No, sir.
Because otherwise they'd be very, very clean.
No, they don't know we're coming.
What should we as the public just look out for in general when we go to a restaurant? We all have our favorite restaurants in our neighborhoods, around, we all go to these small places around where we live. What should we look for?
You can become an informed consumer. We have our inspection reports. The last 2 reports are online at our website under public health. Mm-hmm. So you can go there and become an informed consumer before you go to the facility. Also, you can go into the facility and be informed again. Go to the restroom, wash your hands. If there's no hot water, then they may not have hot water elsewhere in the facility, and that is something that's a critical risk factor. So we would want, we wouldn't want them to be operating. So we would encourage you to tell us.
I've been to restaurants where they didn't have hot water in the restroom, still had good food, but I see what you mean. So why is it important, just for a general edification of those that are watching this, to have restaurants and mobile food trucks inspected?
It's important because we want to make sure that the public remains healthy and that they don't become sick from eating at a restaurant. We look for critical risk factors that the CDC has assigned. Food coming from an approved source, food being handled correctly, temperatures, food coming in and being held at the right temperatures. So we're looking for those risk factors so that people don't become ill.
Well, it's a very important job that you do, and I think controversial in the beginning, then controversial with the mobile food trucks, but at the end of the day, people really rely on it. I receive a lot of comments. So again, it's one of those things in Los Angeles County, people don't realize what we do each and every day, but your role and responsibility in inspecting our eating establishments. That's where we want to go out and relax and have a good time and not get sick. So we want to thank you. First of all, I want to thank you for being on the show and taking time to be here. But more importantly, thank you for what you do each and every day for the citizens of this great county.
Thank you, sir.
Thank you. Thank you again for tuning in to Dialed In. It's time for our They Said What moment of the month. And this month it features President Obama, who took the stage in San Jose to talk healthcare reform, but was thrown for a loop when his speech wasn't at the podium. Take a look.
Good morning, everybody. It is wonderful to see all of you, and I want to thank everybody who's here. I think there's only one problem, and that is that my remarks are not sitting here. People, things by Friday afternoon, things get a little challenged. I'm going to answer a question at the end of the remarks, but I want to make sure that we get the remarks out. People? Oh, goodness. Oh, somebody's tripping. Don't fire. Folks are sweating back there right now. Everybody.
That was great. It's nice to see the president break up an awkward situation with some humor. The Affordable Care Act is over 2,000 pages long, so it's no wonder he needs his remarks in order to speak about health care reform. Lucky for my staff, I can't say that I've ever been in that situation before. Thank you again for tuning in to Dialed In. We'll be back next month with an all-new show.